build the first mortality predictor for dialysis patients, and also your talks on mental health, and in many cases how that is connected to the kids and how malnutrition sort of is prevalent. Would love to understand your thoughts around how in this whole healthcare world the population scale changes can be driven, and what would be one or two most important population scale changes that you would want to talk about?
Yeah. So actually great timing of this question, because we are now sitting in India in 2024. 1.5 billion people are in India, but I don't think people realize that 23 million babies are born in India. Right?
Wow.
Do you know which is the next country? Can you take a guess? China.
China, yeah.
But what is the number?
It would be
take a
close
guess.
To
if India is 23, then how much would be China?
Closer to us or a little less maybe?
It's 9 million.
Wow.
China is 9 million births in a year. India is 23 million.
Wow.
After that is Indonesia, then Nigeria. So if you add the next 4, then that is equivalent to India. So you may argue that India is creating the next batch of humanity for whatever reason. So there is a sort of burden on us as a society. So why am I saying that is that there is this program that I work at iSpirit, and we are starting to build this program, and that is getting some traction with some senior government leaders, political leaders as well. The idea is that if in 2027 a baby is born, by 2047 that baby will be 20 years old. We are talking about 100 years of India by 2047. If that 20-year-old is nurtured and cared for in a completely different way, along the lines of what I was talking about earlier, surrounded by intelligence, even before the baby is delivered, the pregnancy is managed through an embrace of coaches and telemedicine, guidance is given to the mother if she is anemic, early detection of high-risk pregnancies if she is, has a low birth weight pregnancy. All of this is not possible. So how do you put that together in a program and then continue it to a 3-month-old baby, a 6-month-old baby, early detection of, say, neurodevelopmental defects? Today, if you're an autistic child, you may be picked up at the age of 5. But AI can allow you to pick it up at the age of 2. And if you pick up an autistic child at the age of 2, it may not be autistic.
Oh, wow.
Because you can do interventions at 2, which you can't do at 5, right?
Yeah.
So I'm just using that as a small example. Autism is a common problem, but this applies to everything. Even today, if you look at the statistics, a huge number of Indian pregnant women and babies are malnourished. Why is that? Are we short of food? No. It's just because they don't know how to improve their hemoglobin from 9 to 12.
Yeah.
They don't know that diluting the milk in a baby is causing malnutrition in the baby. It's okay to have a slightly softer stool in the baby, but let the baby get the protein. So there's a lot of gaps in the way we are bringing up our current generation. So there is this
lack of knowledge.
Lack of knowledge, but knowledge not leading to action. See, knowledge is there on the Ministry of Health website. In the ASHA manual, it is there. Is it reaching the woman? ASHA manual, there are 10 lakh ASHA workers in the country. They talk to the women in the village. How can that ASHA worker be augmented by AI capabilities or robotic capabilities or drone capabilities? So there is this new idea that, first of all, India has a responsibility to shepherd the next generation of humanity. All over the world, Japan, Italy, South Korea, fertilities have fallen to such a level that populations are shrinking, right? India is not there yet. Therefore, it behooves us to build the strongest humans possible. And I'm not only meaning in the physical sense, even in the mental sense.
Absolutely.
Are these babies good at critical thinking? Are they good at play? Are they good at teamwork? Do they see the world as their playground? Are they caught up in narrow domestic walls like Rabindranath Tagore said in his famous poem? So how do we prevent all of that, and how do we enable the best possible child to emerge by 2047 to lead this country to, this country and maybe even the whole world to a better future.
Yeah.
So, I think we all, whether we work with the government or we work outside the government, should think about these questions. That's one thing I would credit Mr. Modi with, that he has given us this vision of, what is India going to look like in 2047?
Right.
Nobody was talking about that. We used to talk about next 5 years, next elections, next government, last 10 years, caught up in what I would call petty political battles, caste battles, sports battles, whatever. Now we should be asking ourselves, how do we want the world to be in 2047? It is an arbitrary number, but it's an important number. In a way, it's 100 years
It's a good
of our
target.
country.
It's a good
target
it's a
to
good
be
target.
thinking about.
Yes.
So I think so this is one program that we are building, but I would even expand that thought further for the audience and everybody in this room, that the world has seen technologies developed for Western problems, rightfully so, because they were developed in the West, right? Now, with the democratization of technology, a large language model is available here.
Yeah.
Drones are being built up in India. Robots are being built up in India. So I think there is a massive opportunity to build tools to solve problems for India and then take them to the world. And UPI and the whole citizen stack that has been built has proven that A, this is possible, and B, it really works like magic.
Right.
And the UPI journey, that MasterCard and Visa spoke heavily against it, that this is a bad idea. It still happened. Aadhaar was supposed to be a bad idea. It still happened. And guess what? All those bad ideas combined together to build this magical system that allows us to do 13 billion transactions in 1 month free of cost. Nowhere in the world is this possible. And now India is leading this. So why not in healthcare is the point, and why not in education? These are the two areas we really struggle, and these are the real pillars of society. Are you a healthy individual? Are you a well-educated individual? Not by the standards of NCERT and CBSE, but by the standards of critical thinking, teamwork, problem solving, ability to learn and improve the world and to contribute to the world. So I think these are two areas of health and education that we must, really put our efforts into. And you are already doing it. So congratulations. You're in the right place at the right time.
No, thank you so much. You being generous, definitely. It's a long journey for us as